So this is a recording for Chapter 5, Day 5. This lesson was given on October 9th, and then also I'm going to add on to this lesson to Day 6, which was given on October 12th. So today we are talking about patients' rights. Let's see. So patient rights are factors of care that patients can expect to receive whenever they go to any healthcare facility. Each healthcare facility must have written policies of these patient rights so all patients know what they are. It is up to personnel and healthcare workers to respect and honor these rights. It's up to all of us to know what these rights are and to follow them. DHHS, which is the Department of Health and Human Services, implemented a Consumer Bill of Rights and Responsibilities in 1998 that must be recognized and honored by healthcare providers. So because it was developed by the DHHS, this is a federal law. It is not only for Michigan, but it's for all over the U.S. So no matter where you work at, everybody will follow the same Consumer Bill of Rights and Responsibilities. So the rights include the patient has the right to receive accurate, easily understood information and assistance in making informed healthcare decisions about their healthcare plans, professionals, and facilities. So they need to have all information needed in order for them to understand what their plans are for their healthcare. And also when it says easily understood, healthcare providers cannot talk to patients using what we call medical terminology or their medical words, as most patients don't understand what those words are. So instead of saying your husband has had a CVA, which in layman's terms is a stroke, you would say your husband has had a stroke, or if you do use CVA, you would say your husband has had a CVA, which is a stroke, or you have CHF. You wouldn't just leave it at that. You would say you have CHF, which is congestive heart failure. So if you use acronyms or if you use medical words, you need to make sure that your patients and their families understand what you're saying. So you need to describe what you've said. A choice of healthcare providers that is sufficient to ensure access to appropriate high-quality healthcare. So you should have access to healthcare providers that can give you the healthcare that you need. Access to emergency health services when and where the need arises. So it doesn't matter where you are. If I'm in Florida and I need to go to the ER, then I should be able to go to the ER and my insurance should cover what they would normally cover, no matter that I'm in a different state. Patient has the right to fully participate in all decisions related to their health care. So doctors and nurses or the healthcare team may have meetings in which they talk about a patient and maybe their options. Sometimes the patient and or the family may be invited to this team meeting. Sometimes it's just the healthcare team. So they would discuss what's going on with the patient, and then they would again go talk to the patient and or their family and let them know what their plan is, and then whether or not the patient agrees to it, they can, or not agree to it. But they wouldn't just do all the planning and then go ahead and start implementing that plan without talking to the patient and or the family. Be represented by parents, guardians, family members, and or other conservators if they are unable to fully participate in treatment decisions. So let's say if I'm in a coma, then my parents and my sisters should be able to represent me and help make the decisions regarding me. Considerate and respectful care. You need to treat all your patients respectfully and be considerate of them. Not be discriminated against in the delivery of healthcare services based on race, ethnicity, national origin, religion, gender, age, mental or physical disability, sexual orientation, genetic information, or source of payment. So we've talked a lot about this before. You don't discriminate against any of your patients. If President Trump comes in and a homeless person, they should both get the best care that you can give them. It doesn't matter who they are. So everybody should get the best care that they can. The patient has the right to communicate with healthcare providers in confidence and have the confidentiality of their individually identifiable healthcare information is protected. So otherwise, when you talk to healthcare professionals, they will not repeat your information to other people. They will only repeat it as needed to the healthcare team that is needed, that if it's needed to be repeated. But what you tell them, they will not spread around or talk to other people about. Review and copy their own medical records and request amendments to their records. So your healthcare record is actually owned by the healthcare provider, so either by the doctor's office or the hospital, but the patient has the right to get a copy of it whenever they want to. And as they're reading through it, if they see mistakes, then they can request that it be changed. A fair and efficient process for resolving differences with their healthcare plans, healthcare providers, and the institutions that serve them, including a rigorous system of internal review and an independent system of external review. So if something is going on with your healthcare that you're not happy with, then you can there can be some review done to see what should have been done or what could be done. So here is a video. Previously, we watched some other videos on medical assisted suicide. In this video, it's about a wife who talks about her husband who died quite young. And they had thought about, I think it sounds like they kind of thought about a medical assisted suicide, but in the end, they decide not to, even though the doctors told them he just had, I think, 4 months to live, and instead he lived another 4 years. So it's just her viewpoint on it. Again, with these videos with the medical assisted suicide, I'm not trying to persuade you to believe that medical assisted suicide is right or wrong. It's completely an individual person's choice as to what they believe in it. I'm not trying to persuade you one way or another. I'm just letting you know the different views of them. I'm not going to play this video in the slideshow right now because you won't be able to hear the words. And so you will want to go back to the Google Classroom and look for the Day 5 slides and go ahead and watch this video on your own. So we're going to pass over this. So residents in long-term care facilities are guaranteed certain rights under the Omnibus Budget Reconciliation Act, or OBRA, of 1987. And I know that doesn't sound like it has absolutely anything to do with resident rights, but you'll just want to remember that OBRA has to do with residents' rights. The Residents' Bill of Rights must be posted in facilities, and residents or their guardians must be informed of their rights. So again, you're talking about residents. So residents are in long-term care facilities. They could be in a nursing home, assisted care facility. So facilities such as that. Residents have their free choice regarding physician, treatment, care, and participation in research. In many healthcare and long-term facilities, they have a facility doctor that will come once or twice a week and see patients. The doctor usually has a good relationship with the staff there. But if somebody comes there and they want to keep their primary care physician that they've had for the last 50 years, they can certainly do so. Or if they want a different, maybe a visiting physician, a different physician to come in with a different company, then they certainly have that right to do so. They do not have to see the facility doctor. They have the right to choose which doctor they can see. And of course, they can decide on what treatment and care they have also. They have the right of freedom from abuse and chemical or physical restraints. So when my grandpa went into the assisted care facility, in the first month he had 2 or 3 falls, and he had never fallen before, so we were curious as to why this was all of a sudden happening now that he was moved there. And we ended up finding out that they were giving him Ativan at lunchtime, because they thought that kind of all residents go crazy at lunchtime, and they wanted to keep the residents more calm after lunch. And so he was automatically given Ativan, which he had never ever taken before. And so in that is a type of chemical restraint, because they were giving him that so that he will calm down. And they took him off, and he didn't go crazy after lunch. He just sat in his chair and watched TV like he normally did. So a chemical restraint would be giving patients medication to make them sleep when they don't want to be bothered by the patient, maybe, or whatever the case. So that would be a type of a chemical restraint. Of course, physical restraint is maybe locking them in their room and not letting them come out of the room. abuse is being mean to them. It could be physical abuse, it could be verbal abuse, or psychological abuse. They have the right to privacy and confidentiality of personal and clinical records. So again, their information should not be shared with others. They have the right to accommodation of needs and choice regarding activities, schedules, and health care. So the patients can decide whether they want to participate in activities or not. Again, my grandpa, we didn't think he would participate in any activities, especially craft activities at this care facility, but he certainly has. We've been painting some pictures. But sometimes we're there visiting him and we'll do a craft with him, or sometimes we ask him if he wants to do a craft and he says no, and that's fine. That's his choice. He doesn't have to. If patients want to stay up all night, they certainly have the right to stay up all night. If they want to sleep through breakfast, they should have that right to sleep through breakfast. And the facility should have some easy food to give to the residents after they wake up when they want to. There's one long-term care facility up in Alma that's very, very large. And they actually, for one section, they have a dining room, and it's a lot like a restaurant. The residents go and eat when they want to, and they sit down where they want to, and they order. So it's almost like a restaurant there. So sometimes they do have definite schedules, as to when lunch is and dinner and breakfast, and, that's understandable. It has to be done like that. But it's a patient's right to do what they want when they want, within reason. And I know, for my grandpa, they said that I'll talk about that in a minute. So they have the right to voice grievances without fear or retaliation or discrimination. So if they feel that something is wrong there at the facility, they can certainly voice what is going on. They're allowed to organize and participate in family resident groups and in social, religious, and community activities. So if the person wants to go to church, or if they want to attend church services there at the facility, they can certainly do so. They can decide what they would like to do. They just because they're at a facility, the facility cannot manage personal funds or use their personal possessions. So the resident has the right to manage their own personal funds and to use their personal possessions. So at most facilities, people wear their own clothes that they bring in. And they bring in some items to their room. Sometimes it could be a chair, it could be a bed, it could be a dresser, but sometimes it's just little knickknacks that they want in their room, but they have the right to do that. They also have the right to unlimited access to immediate family and relatives. So back to when my grandpa first arrived at the facility, they told us that if we wanted to, we could visit him at 2 a.m. in the morning. We could visit him anytime we wanted to. So of course we don't, but we can visit whenever we want to. Another resident right is information about medical benefits, medical records, survey results, deficiencies of the facility, and advocacy groups, including the Ombudsman Program, which is the state representative who checks on resident care and violations rights. So the state comes in and they look at these facilities to make sure they're up to code. So if they have violations, then the residents have the right to know what those violations are. And they have the right to receive information about their survey results for that facility and any of their own medical records also. If they have a spouse in the same facility, they have the right to share a room with his or her spouse if both of them are there. And they have the right to remain in the facility and not be transferred or discharged except for some circumstances. So, if they're not able to be medically cared for in the facility, then they could certainly be discharged, and more than likely the facility would help them find a place that they would be able to go to. But a facility just can't come in and say, oh, you're done here, you're moving out, let's go out of here. They cannot do that. So the students in the class worked on their workbook at this time for Chapter 5. So there's also the Affordable Care Act, which is the Patient Protection and Affordable Care Act, the PPAC. This we had talked about before at a couple chapters ago. It's also known as Obamacare. So we're going to go through this kind of quickly because we've talked a lot about this already before. So the Affordable Care Act guarantees that certain rights pertaining to health insurance coverage. Consumers have the right to an easy to understand summary of insurance benefits and coverage. So again, they have to use terms that people can understand. Coverage for essential health benefits such as emergency care, hospitalization, prescription drugs, maternity care, and newborn care. So all of these benefits would be covered by insurance no matter what. Consumers have the right to preventative care for specific procedures at no cost to the consumer. So, like your well child visits that you go to every year, that is considered to be preventative care. Coverage to age 26 under a parent's health care plan if eligible. So it doesn't matter, even those who are married, it used to, a lot of times prior to this, if you were married, you were no longer being able to be covered under your parents' health insurance. But at this point, if you are married and you're under 26, you can still be covered under your parents' health care plan. Choose any available participating primary care provider as their doctor. So you have the right to choose who your doctor is. Now, you may choose a doctor who's out of network. You can still go to that doctor, but you may have to pay more. Or you can choose a doctor who's in network in which you can pay less. But you have the right to choose who you go to. They have the right to receive care for emergency medical conditions at any emergency care facility without pre-authorization, without higher co-payments for out-of-network services. So what that pre-authorization means is that they do not have to go to their, when pre-authorization is needed, most of the time the patient has to go to their doctor's office, and then their doctor refers them to maybe a specialist. And then sometimes before they see that specialist, the insurance has to authorize them and tell them it's okay to go. Or like with home care, and sometimes we have to call the insurance company and they will authorize and give us approval to go see the patient for maybe 5 visits. If we want to see the patient more than 5 visits, then we have to call to get another pre-authorization. So that's what that means. So of course with emergency care, you don't have to get that pre-authorization. You can go right to the ER. Also, if you go out of network, you won't be charged more. So like I said earlier, if I was in Florida, if I had to go to the ER, it would be probably out of network for me. I could still go and I wouldn't be charged those out of network costs. No annual lifetime limits on healthcare benefits. So it doesn't matter if you're a very sickly person, you have doctor visits and lots of medication. It doesn't matter how much you use your insurance, you can continue to have it. No arbitrary withdrawal or cancellation of insurance coverage, so they can't just cancel it. The only time they can cancel it if you are not paying your deductible. Consumers have the right to appeal any healthcare plan decision if the health insurance company denies payment for medical treatment or service. So if they deny payment, you can call the insurance company and ask for an appeal, and then they would have probably a meeting as to whether or not they would cover it or not. A review by an independent organization if a health insurance company denies payment for a claim or terminates insurance coverage. So you could go to a different organization and they would review the situation. A refund of a percentage of their premiums if an insurance company does not spend at least 80 to 85% of premiums paid on healthcare versus administrative costs, such as salaries and marketing. So you get a refund if all that money is not spent on premiums as it's supposed to be. So healthcare workers can face job loss, fines, and even imprisonment if they do not follow and grant established patient or resident rights. By observing these rights, the healthcare worker helps to ensure the patient's safety, privacy, and well-being and always provides quality care. This is very important that you know what these rights are. Here is another video, and I'm going to skip over it. So there was a video there about a doctor who was misleading patients and was being sued. So again, check that out. Again, I'm not saying all doctors are bad. Unfortunately, during this chapter, we talk about bad things that doctors do. One, it's not only doctors, but it can be therapists, it can be nurses, it can be anyone in the healthcare field. Excuse me. obviously there's lots and lots of good doctors. Most doctors and people in healthcare fields care about their patients, want their best for the patients. So that's just a doctor who's being sued for malpractice and for some other things. So you can just go back to the Google Classroom and check out that video also. So here is a learning check, just review questions. The Omnibus Budget Reconciliation Act of 1987 states patients' rights. Is that true or false? That is false. The OBRA is for residents' rights. Does the resident have the right to share a room with their spouse in the same facility? Is that true? Yes, they can, or no, they can't. And yes, the patient or residents who are married can share the same room at the same facility. Can information in a patient's health record be released to their spouse? Kind of a trick question. Yes, if it is with the patient's consent. No, if there is no consent from the patient. Can confidential information be shared with other members of the healthcare team? Yes, only the healthcare workers that need to know that information. A patient is entitled to free health care. Is that a patient right? And the answer is false. That's not a patient right. A patient has the right to considerate and respectful care. Is that true or false? Of course, it is true, and that is the patient right. A patient does not have the right to review their medical bills. And that is false. They do have the right. A patient does not have the right to know if a healthcare facility has a relationship with an educational institute. That's something we talked about in class, but that is false. A resident in a long-term care facility has the right to choose their doctor. And that is true. So that's it for this section. I'm going to go ahead and pause the video and switch it to a different slideshow, and we'll continue with day 6. Okay, so this next section was day 6 of chapter 5, and it was given on the 12th. It first starts off with a video, and it's actually a good video. Since we have been talking about so much about bad things doctors have done, I decided to show a video that was positive about a doctor who draws on patients and pediatrics. He's a pediatric surgeon, and he draws on their dressings after surgery of these patients. So just a good video. It shows that he gives a personal touch to all of his patients, and his patients know that he cares for them, and by doing this. So we are going to skip over it though. So again, you want to go to Google Classroom to day 6 slides in order to watch it yourself. But we will skip over it. It is a good video, and I do recommend you watching. So today we talked about advanced directives for healthcare. It's also known as legal directives, and they are legal documents that allow individuals to state what medical treatment they want or do not want in the event that they become incapacitated or are unable to express their wishes regarding medical care. So in there, I might put whether I want to have life support or not, or how long I want life support, whether I want my organs to be donated or not, or whether I want my whole body to be donated to research. So be what surgery I may or may not want. There's 2 main types. There's living wills, and there's designation of healthcare surrogate, or the durable power of attorney, usually called the POA or the DPOA. So living wills are documents that allow individuals to state what measures should or should not be taken to prolong life when their conditions are terminal. It must be signed when an individual is competent and witnessed by 2 adults who cannot benefit from their death. So such as if let's say if I'm not married, so if my sisters were in my will to receive the money that I have, they cannot be a witness to my living will because they would benefit from me dying because they would get my money. So that's what that means. I would have to have somebody witness it who is not in my will to receive any of my money. Most states have laws that allow the withholding of life-sustaining procedures and that will honor living wills, but Michigan is not one of them. Frequently results in a DNR, or a do not resuscitate order, which means that you do not give CPR if there's a DNR order, or you do not start their heart beating again if the heart stops or if they stop breathing. And a physician must sign an order. So in order for a DNR order to be legal and to be for other physicians to follow it, it must be a signed order by the physician. So Alec Carter is a 25-year-old who suffers from a progressive motor paralysis caused by Guillain-Barré syndrome. For 3 years since the onset of the disorder, Allie has been intubated and living on a respirator. She depends on this respirator support to live since her respiratory muscles have atrophied, which means they have become very weak. Last week, the chief neurologist diagnosed a nerve disorder resulting in complete permanent loss of the motor neurons, or the motor nerves. Allie was informed that there was no cure for her condition. At this point, all she can do is 2 blinks for yes and 1 for no. Allie has clearly indicated that she wants respiratory support discontinued. Does she have the right to refuse the respirator? So my guess would be when they would ask her this question, do you want to continue with the respirator? She would say, her 2 blinks for yes, or 1 blink for no. They might also say, is your birthday such and such? And then she would say yes or no. Or are you in this town? Is your name such and such? And just to make sure she answered all questions correctly and to make sure she was competent enough to make the decision as to whether or not she wants the respirator or not. So does she have the right to refuse? This is a tough one. Patients certainly have the right to refuse. Do doctors have the authority to discontinue the respirator? Do they have the authority to force treatment? Even though she's not able to talk, she's not able to move, she has certainly made her wishes clear by her blinking of yes or no as to what she wants. Is this difficult for doctors and for nurses to maybe stop that respirator? It certainly is, because in the healthcare field, we certainly want people to help. We want to help people and get them better. And obviously, removing this respirator would not help her or help her to get better. But it is certainly tough to do. But you have to follow with what the patient wants. Here is another video. It's a clip from ER. It's about a guy who comes in and he has CF, cystic fibrosis. They say he's an adult and he has a DNR order. So, of course, they don't take their word for it, and they call a doctor to see if he has a DNR order. And come to find out, he's actually 17. So he is not legally allowed to make those decisions himself. So, good recording. Go ahead and check it out for sure. Now, in the recording, you'll see that he says no, he does not he does have a DNR and he does not want to be intubated. So, of course, he is not an adult, so he can't make those decisions. But let's say if he was an adult, let's say he was 18 or 19, and he made his wishes clear that he did not want to be intubated. So they don't intubate him. But he eventually becomes unconscious, and as he stops breathing, would they perform CPR on him, or would they not? Knowing that he does not have a legal DNR order. If he did not have a DNR order, and if he became unconscious, then they would do CPR on him to bring him back, because they're not able to ask him. So they would have to, and he does not have that legal document that says do not resuscitate. So I have questions here. Should 17-year-olds be allowed to make decisions? They're close to 18. They're close to being adults. Or should it be up to the parents? Tough choices. I don't know what I would do for my daughter. Somebody in one of the classes stated it depends on the maturity of the patient, of the child who is 17. Definitely, that could depend on it. It's also a conversation that parents and adults, or parents and children, need to have, especially as the children get older. I've certainly made it clear to my parents what my wishes are. And I need to know what my parents' wishes are also, because it goes both ways. So a designation of a healthcare surrogate is called a durable power of attorney, POA or DPOA. It's a document that permits an individual, known as a principal, to appoint another person, known as an agent, to make decisions regarding healthcare, as a principal should become unable to make decisions. So if I'm unable to make decisions regarding my healthcare, then my dad is the one to make those decisions for me, and he has that legal power to do that. It includes providing or withholding specific medical or surgical procedures, hiring or dismissing healthcare providers, spending or withholding funds for healthcare, and having access to medical records. So therefore, if I was in a coma and I was not able to talk, my dad would have the right to look at the medical records. He would have the right to decide whether I had surgery or not. He has the right to hire or fire doctors as he sees fit. And he would make the decisions as to when the plug would be pulled if necessary, or when not to pull it. And what surgeries I have. So that's what that means. Most frequently it's given to the spouse or adult children, but POAs can be given to any qualified adult. So I had a patient once, and she was the POA for a really good friend of hers. And as their friend got older and started having more health issues, then my patient wasn't really fond of being her POA, and was going to have a conversation with her about it because she didn't want to make those decisions for her. So it's definitely a conversation you have to have with whoever is your POA as to whether or not they want to or could make those tough decisions for you. A POA must be signed by the principal agent and, again, one or two adult witnesses. So why do you have to have witnesses when you have this? You need to have a witness to make sure that you are signing it under your own free will and that you're not being forced to sign it. And that it says what you want it to say and not maybe what somebody else wants it to say. The Patient Self-Determination Act, the PSDA Act, it's a federal law of 1990. So again, since it's federal, it's for all over the U.S. and not just for Michigan. It mandates that all healthcare facilities receiving any type of federal aid comply with the following requirements. Inform every adult, both orally and in writing, of their right under state law to make decisions concerning medical care, including the right to refuse treatment and right to die options. So all of our patients need to know that they have the right to refuse any treatment. Provide information and assistance in preparing advance directives. So when I was in home care, the first person who went out to see that patient would talk to the patient about advance directives, would ask if they had advance directives, would ask if they were on file at the doctor's office. You would put them on file also. And if they did not, then we would give them paperwork or information on how to fill out advance directives. Document any advance directives on the patient's record. So it needs to be in the patient's record because if you're in the hospital and you don't have those advance directives right in your pocket, they're not going to know what those are. So you need to have them on file with your doctor. And so that they know that you did them, that they're yours, so that somebody else doesn't come in with another advance directive that is not even close to what you want, in which they could afford your signature or something like that. So you have to make sure that they're on file at the doctor's office. It mandates that all healthcare facilities receiving any type of federal aid comply with the following. So provide written statements to implement the patient's rights and decision-making process, and affirm that there will be no discrimination or effect on care because of the advance directives. So the advance directives will be followed, but they won't discriminate you, knowing that, let's say, maybe because you want to donate your organs, they can do everything that they can to kind of let you die safely so they can donate your organs. You're still going to get good quality care. So what I'm saying is they could not do anything to let you die so that they could donate your organs. They would not do that. Educate the staff on the medical and legal issues of advance directives. So all staff need to know the medical and legal issues of advance directives so they understand and know what to follow. ensures that patients are informed of their rights and have the opportunity to determine the care they will receive. So patients get to decide what kind of care they have. All healthcare workers must be aware of and honor advance or legal directives. Healthcare workers should give serious consideration to preparing their own advance directives also. So professional standards. By always following certain standards, you can protect yourself and your employer and the patient. Some basic standards are: perform only those procedures for which you have been trained and are legally permitted to do so. Much of this we've already talked about before, so I'm going to go through it kind of quickly. We have talked about you can only perform procedures or treatments that you know what to do for, and if you don't know how to do it, then it's up to you to tell them, no, you can't do it. Must be qualified to perform a procedure, and you must have the necessary training needed in order to perform that procedure. If you're not qualified, it's your responsibility to state you have not been trained and to refuse to do it until you receive proper instruction. And if you are not legally permitted to either perform a procedure or to sign documents, it's your responsibility to refuse to do so because of legal limitations. As a healthcare healthcare professional, you should not be signing a person's advance directives or their living wills. Use approved and correct methods while performing any procedure. You need to follow the specific methods taught by qualified instructors in educational facilities or observe and learn procedures from your employer or authorized personnel. And they must have an approved procedures manual that explains step-by-step methods for performing these tasks. And again, it's up to you to make sure you follow those steps. Obtain proper authorization before performing and procedures. So in most cases, you're going to get your orders from your doctor or your supervisor. In some healthcare careers, you will obtain authorization directly from the doctor, therapist, or individual in charge of a patient's care. In other careers, you will obtain authorization by checking written orders. And in careers where you have neither access to patients' records nor direct contact with individuals in charge of care, immediate supervisor will interpret orders and then direct you to perform procedures. So, let's say me as an occupational therapist, I get orders from the doctors. So you may get a written script that says on the script where the doctor handwrites it that you are to see the patient to evaluate and treat for 4 weeks in home care. I would get an order on my tablet from the nurse actually would write the order and then get approval from the doctor for me to see the patient. Like a certified OT assistant would get their orders from me, in which I would tell them what to do, and they would follow the orders that I give them. And of course, I would get my orders from the doctors, so that's how that would work. Identify the patient. Check the name bands of patients if they have one. State the patient's name clearly, repeating if necessary to make sure you have the correct patient. Some facilities use barcodes that can be scanned to identify the patient. And in some long-term care facilities, they use a photo ID, much like I would have here. I mentioned that a large facility in Alma, in which the patients could go to the dining room and it would be much like a restaurant. At that facility, every resident has a name badge because it is a very large facility that everybody has to wear a name badge at all times, all residents do. Obtain the patient's consent before performing any procedure. It's something we talked about, and you always want to explain to them what you are doing. You may not want to say, may I take your blood pressure? Because the patient can say no. Instead, say, the doctor would like me to check your blood pressure. You're identifying the procedure, and you're obtaining consent by the patient's acceptance or lack of objection. Now, if you say, the doctor would like me to take your blood pressure, can the patient still say, no, I don't want you to? Yes, that is certainly the case. If they say no, you can't take it. But if you say the doctor would like me to check the blood pressure, you're telling them what you're going to do. You're telling them who wants it done. And usually, in most cases, they will give you your arm to take your blood pressure. So either way, however you say, the patients can still say no, and you would still have to comply to that. Never sign your name as a witness to any written consent or document unless otherwise authorized to. Observe all safety precautions. We talked about a lot of this last chapter. Handle equipment carefully. Be alert to all aspects of safety. Keep all information confidential. We have talked about this a lot. This is very important that you don't talk about your patients with other people. Includes oral or written communication. If you go to the cafeteria to eat lunch, you don't want a patient's written medical record to be laid out in front of you because somebody could go by and read it. Don't place records in an area where they can be seen by others, and ensure conversations about patients cannot be heard by others. Again, don't talk about patients in public places. Even if you don't say their name, you may say something that identifies who that patient is. So you have to make sure all conversations regarding patients are done privately. Avoid discussing patients with others at home, in social situations, in public places, or anywhere outside the agency. Think before you speak and carefully consider everything you say. Do not reveal information to a patient unless you are specifically permitted to do so. If a patient has a new diagnosis, you don't want to go right in and talk to that patient about the new diagnosis unless you've been told to. Maybe they don't want that patient to know about the diagnosis yet because they might be checking out other situations too. So don't talk about things with your patients that you shouldn't do. Again, treat all patients equally, something we've talked about a lot. Provide care to all individuals to the best of your ability. Accept no tips or bribes for the care you provide. You receive a salary for your services, and the care you provide should not be influenced by the amount of money a patient can afford to pay. So let's say I go to see a patient and they want to give me a necklace because they appreciate all the care that I gave them. Can I accept the necklace? The answer is no, I cannot accept the necklace. What if a patient is discharged from a hospital and their family wants to provide pizza or cookies or brownies to everybody on that floor, again, to say thank you and appreciative of that care that they were given? Can the staff accept that pizza or those cookies? The answer is yes, they can accept them. Many times patients, especially during the holidays, will bring in cookies or snacks or candy for the staff, and that is acceptable. When I was working, I think our rule for our facility was you couldn't accept anything more than $5. Something else, another reason why you don't want to accept items from patients, especially jewelry, it could be a painting or a picture or whatever it may be, is because maybe the patient's forgetful and they may accuse you of stealing. Or maybe the family will come in and notice that things are missing and they accuse you of stealing. So don't accept things from patients. I have certainly, doing home care, I have been offered coffee, tea, water, cookies, pizza. I've been offered a lot of different things. I never eat in the patient's home. One, because I'm not there to eat. I'm there to do a job and to work with my patient. I wouldn't even accept water unless I was like coughing and I needed a drink of water, or I wouldn't sit and drink coffee with my patients. I'm there as a healthcare provider. I'm not there as their friend, so I would not do that. And sometimes I would always say no the first time if they offered me cookies or brownies or whatever it is that they made. I would always say no the first time. But if they would continue, sometimes you're going to offend them if you keep saying no. So I would say, sure, go ahead, put it on a plate or put it in a bag and I'll take it with me. Once I got in the car, for me, I decided then whether I would eat it or not, depending on the patient and if I trusted it to be safe or not. So that's fine. We did have a patient, and they had a large garden, and whenever clinicians would go, they would want you to take some of their produce from their garden. And there was a note in there that said, whatever they offer, to make sure that you take, because if you don't, you will deeply offend them, the patient and their family. So if you went and they offered you eggplant, we were told, if you don't like eggplant, we were told to take it, because we want to be respectful of that patient and their culture. So something like that you can. So an exception to this rule is if a patient or family member brings the entire floor unit thank you gifts such as cookies or candy, you can certainly do that. If any error occurs or you make a mistake, report it immediately to your supervisor. Never try to hide or ignore an error. So all errors you want to make sure you report. Don't hide them. You need to report them. You need to say what it was. Make every effort to correct the situation as soon as possible and to take responsibility. Behave professionally and dress language, manners, and actions. Take pride in your profession and in the work that you do. Promote a positive attitude at all times. So you want to make sure you dress professionally. Some facilities have color-coded scrubs that professionals have to wear, or clinicians have to wear. So at the hospital, at Memorial Hospital, I think nurses wear blue and therapists wear an olive green color. I don't know what the other colors are. When I was working, I basically dressed kind of like what I do as I teach, maybe a little bit more casual than that at times. I could not wear scrubs. I had to wear regular clothes. But our nurses, they wore scrubs and they had to wear either red or white because that was our colors. So you have to dress according to your job. As a therapist, I wouldn't wear heels because I move in around too much. I don't think it would be safe to wear heels. You'd never see nurses wearing heels, so you have to dress accordingly. And this is something that we'll talk about more in another chapter also. Even when standards are followed and errors leading to legal action sometimes still occur. There's liability insurance that people can have. Doctors certainly have it. I never had it as an occupational therapist, but if I wanted extra protection, I could have gotten liability insurance. It is your responsibility to understand the legal and ethical implications of your particular healthcare career. Never hesitate to ask specific questions or to request written policies. So a person that has been deemed incompetent can sign a living will. Is that true or false? That is false. The patient must be competent to sign a living will. What does DNR stand for? Do not resuscitate, so there's no CPR. DNR is valid without a physician's signature. Is that true or false? That is false. It must have a doctor's signature. Advanced directives do not need to be put in a patient's healthcare record, and that is false. It is okay to receive a necklace from a patient as a gift. That is false. Think before you speak and consider what you say. That is true. It is important to observe all safety precautions. That is true. It is okay to wear clothing with vulgar writing on it. That is false. If you make a mistake, you do not need to report it. That is false. You need to report it immediately to your supervisor. When giving meds, go in a room and quickly give them their meds. That is false. You need to identify the patient 2 ways before giving the meds, and you probably need to tell the patient what meds they are taking. So that is the end of Chapter 5. Be sure if you have any questions, any concerns, you be sure to let me know, and I will get back with you. Go back to Google Classroom to watch those videos. And again, let me know if you have any questions. Thank you.